Good morning, everybody. To 8 p.m. last night, there were more than 107,000 tests in New South Wales. Thank you to everybody who came forward and got tested. Unfortunately, we did have 262 cases of community transmission. At least 45 of those were infectious in the community. And I do also sadly want to report that 5 people lost their lives with COVID to this point in time in the last 24 hours. 3 people in their 60s, 1 person in their 70s, 1 person in their 80s, and of course we extend our deepest condolences to all of their loved ones at the tragic loss. It's horrible that during this time families are losing their loved ones. I do also want to convey that unfortunately 4 out of those 5 people were not vaccinated at all, and 1 person had 1 dose of AstraZeneca. So again, no one who's died has had both doses of the vaccine, and I cannot stress enough how it's so important for everybody of all ages to come forward and get the vaccine. I also want to stress that, as Dr. Chant reported yesterday, there was a high level of virus detected in the Hunter and the Upper Hunter region, and overnight there have been some cases in that region. And as a result, similar to what occurred in Orange, there will be a 1-week lockdown in the Hunter and Upper Hunter region. The local government areas impacted are Newcastle, Lake Macquarie, Maitland, Port Stephens, Cessnock, Dungog, Singleton and Muswellbrook. These community leaders and local leaders are being advised of this. That will commence at 5 p.m. tonight and go until midnight next Thursday. So a week, similar to what occurred in Orange, and hopefully similar to what occurred in Orange, we'll see that community have its restrictions or stay at home lifted at that time. But having said that, I also want to confirm that the arrangements in those 8 local government areas I've announced in the Hunter and Upper Hunter will be exactly the same as that exists in Greater Sydney, including the Central Coast. So that means no school and the same stay-at-home provisions apply. I also want to stress that yesterday, after a number of conversations with the Prime Minister, that I was advised by him directly that New South Wales will be receiving an extra 180,000 doses of Pfizer, which is good news, over the next fortnight, commencing in the week 9th of August and the 16th of August. Now, this is very positive news. It means that in the week of 16th August, we can redirect those doses we've taken from the regions for the HSC students, and it also means we can put the balance into those 8 local government areas in Greater Sydney of concern in particular. So I'm very relieved about that. I want to thank the Prime Minister for those extra doses on top of what we've already been allocated. That will make a big difference in us containing the spread, because we know from the stats and the facts that getting the vaccine reduces your chance of being contagious, but also it saves you staying out of hospital, and it saves you passing it on to all your loved ones. And we know how critical that is. But I'm urging everybody to come forward and get vaccinated. It doesn't matter which vaccine you're offered. If you have any concerns, please go through your GP, but get vaccinated, and I can't stress that enough. If we all work hard, we can get to that 6 million target by the end of August, and these extra doses, of course, will help. So I'm urging everybody to continue getting vaccinated. Our vaccination program and how successful we are will lead to us having a freer life beyond August 29. But I also want to stress that the vaccine rollout is absolutely critical to how any society lives with the Delta strain. It's been demonstrated time and time again how contagious this is, and you can't compare this strain to other strains that we've dealt with. You can't compare this strain to what's happened previously. It is a new phenomenon. It is a game changer. But one tool we have now, we didn't have before, is the vaccine. Because the vaccine is around, it allows us to fight this strain. It allows us to fight reducing our number of cases, because it reduces contagiousness or transmission, and I can't stress that enough. Dr. Chant will now provide the health update, and then we'll take your questions. Thank you.
Thank you, Premier. So there were 262 cases of locally acquired COVID in the 24 hours to 8 p.m. last night, and there were 6 overseas acquired cases. There are currently 290 COVID cases admitted to hospital and 51 people in intensive care, and 24 of whom require ventilation. And we are seeing young people in ICU. We're seeing people in their teens, in their 20s and their 30s, as well as older individuals. I want to acknowledge that younger people have not had the opportunity to be vaccinated because of the access to Pfizer, and I just want to indicate that I'm aware of that. But my comments are that please now is the time to strongly consider getting vaccinated if you're over 18. And for the elderly who have not been vaccinated, again, I put out a plea to you. Make an appointment, get vaccinated. Even one vaccine reduces hospitalisation and death, both Pfizer and AstraZeneca, by 70%. And 2 doses achieves about a 90% effectiveness against hospitalisation and death. We have the tools to allow us to protect ourselves and our loved ones from COVID. So I just do call everyone to act now. Sadly, we've had the 5 deaths, and as the Premier has indicated, 4 of them were not vaccinated. 1 was vaccinated, but had his 1 dose late May. So again, can I also reiterate my strongest advice? If you have had your vaccine, first dose of AstraZeneca, within the last 4 weeks, now is the time to get your 2nd dose. Please get your 2nd dose. Do not delay for the 3 months. There will be future access to other specific vaccines which will sustain your immunity, so do not be worried. We need to get you vaccinated with those 2 doses as soon as possible. In terms of the stay-at-home restrictions, the Premier has indicated that we are, because we have seen a number of cases, and I'll just give you an update of what's transpired overnight. Obviously, these case numbers will appear in tomorrow's case numbers. So we're currently providing, Hunter New England's providing care and support to 5 people that were diagnosed, and they're doing the contact tracing. So while the source of the infections continues to be investigated, we now know the source. We now think that the source originated from a gathering on Blacksmith Beach on Friday night, which is believed to be the source of the initial cases. And can I just thank the people involved? I mean, not that I want to see gatherings, but I also want people to tell us the truth. If they've made a wrong judgment, if they've taken a course of action that they regret, please tell us the truth, because that will allow us to find out who was there and stop any chains of transmission. So two of the confirmed cases, so what the Public Health Unit has done is identified a case, tested around the case, and we've found some additional cases. And 2 are confirmed cases in student at Maitland Christian School. That school has been closed for cleaning today. We're working with the New South Wales Health and Department of Education and obviously the school. All of the parents and the children are asked to go home and isolate, and will provide further advice as we work through the days that the children were infectious and who they had contact with during their time. So also we're calling out that a couple of venues, but I do have to say that as the contact tracers go through the other cases, there may be other venues. So I do urge anyone who's been in that Newcastle area. So it's the Orchmuchi Library at the University of Newcastle on the 30th of July from 5 p.m. to 11 p.m. and Target at Glendale Shopping Village from the 1st of August from 8:50 to 1 o'clock. And as I indicated, more exposure sites will be nominated. So what we are putting in place is the Sydney-wide restrictions in the areas of Newcastle, Lake Macquarie, Maitland, Port Stephens, Cessnock, Dungog, Singleton and Muswellbrook local government areas, and they will be in place from 5 p.m. today. But I do urge everyone, whilst those orders don't come in place until 5 o'clock, I would ask people to act on that now. Please go home, isolate and stay home. Also, just to remind people that the stay-at-home provisions do not permit visitors to your home. And so this applies to all social visits from those outside your household, including family and friends. And we're also moving schools to learn from home for the week. In addition, the Morisset High School has also been closed for cleaning, and that's following the confirmation of a confirmed case who was a student at the school. Now, this student resides in the Central Coast, and this case is not linked to the other cases. So separately, there's a case in Central Coast, and 8 of the cases, there are 9 cases, but 8 of the cases reside in the same household. So there's a household impacted in the Central Coast, and obviously some children in that household have attended the Morisset High School. And so work is being done there. In addition, I would like to call out that we've had some sewage detections in Armidale and Dubbo. Now, whilst in Armidale there had been a low detection previously, and that was thought to be related to a case in that area, it is no time for complacency. The levels in the sewage have become higher, and we are concerned that there may be active cases in the area of Armidale. So I call everyone in Armidale to come out and get tested, and also the Dubbo sewage plant that has also had a detection. So in summary, my key messages are vaccination. We need to continue to take up the opportunities for vaccination. So my message is to everyone over 18, please consider your options for vaccination. And as I said, I can't express my regret at seeing people that have had the elderly people that are not vaccinated. We need to get that vaccine into arms if we're going to protect them and also protect their loved ones. It is important that we follow the stay-at-home directions and do our part in curbing the spread of COVID.
Dr. Chan, sorry, just on the beach gathering, obviously it's not illegal at the moment to have a beach gathering in Newcastle. Did someone come up from the Central Coast, or is that how this happened? Is that what was wrong?
So we believe that there may have been people there from Greater Sydney, and that is how it's introduced. But as I said, our strongest focus, and I really ask the media to also assist us here, is getting to the bottom of exactly how the disease was transmitted and introduced into Newcastle. That is in the best interests of everyone at this time, for us to get the bottom of it. And I just think we need to work with individuals, and I just thank people for being open and honest with us so that we can track down any of these chains of transmission. And I ask the media to respect that as the principal objective at the moment.
Dr. Chan, it's gone quite widespread with this lockdown. It's not just Newcastle, that area. You've gone the Upper Hunter as well. Why is that?
The reason is that we have had advice from both on the ground from the local public health unit, but also other people that know the local area well, and it's connected. So we know that a lot of people come in from various sites to work or shop or access services in those areas. So, and we didn't want gaps in terms of the being continuous with Greater Sydney lockdown. So for simplicity, we've taken a broad approach to the lockdown whilst we determine these unrecognised chains. Now, whilst the transmission we know about at the moment, we are following up those leads, it still doesn't totally explain the sewage detections yesterday. So whilst it's very pleasing that the case came forward and got tested and allowed us to unpack this chain of transmission, it doesn't fully explain today, our cases does not fully explain the detections, and so we don't want anyone to be complacent that we have got the full picture at this stage. So again, those testing levels need to be high, and can I thank the community? The community response has been amazing, and we see this time and time again in rural communities. How well you respond to those messages and the messages from your local public health unit as well.
How much greater is the threat level for regional New South Wales now that we're seeing, we've kept it out from the regions for so long, but it's emerged, and what about the rest of regional New South Wales?
Obviously, we are very concerned about regional New South Wales, and that's why we've got some of those protections in place in regional New South Wales in relation to mask wearing, limited density restrictions and other things. We've also, I think, regional New South Wales would be very attuned to the risk of people that have come in from Greater Sydney. And I know that there's probably been lots of reports, and police have probably responded lots of times to rural communities highlighting when people are in breach. And I know that police have also put in a lot of surveillance activities. So yes, we are very concerned, and that's why no one can be complacent. And I'm asking, whilst we have allowed rural New South Wales to continue a range of activities which is not available to the people in Sydney, we need to make sure that you are still vigilant about signs and symptoms, getting tested. You cannot be complacent. The risk exists everywhere, and as you're aware, Queensland is also experiencing a different Delta outbreak, and so we're conscious of those risks in the northern part because we are all connected and it is impossible to absolutely prevent any movement. I also want to acknowledge the work we're doing with industry to also make sure that we've got very strong COVID safety plans and vigilance in some of those industries that by necessity need to put food on tables and distribute food and distribute key products across the regions.
That you reported on, what level of care were they receiving? Were they actually in hospital at the time or at home at the time of their death?
So if I go through the niche, there was a man in his 60s who was died in Campbelltown Hospital. He was tested positive on the July 29th. There was a man in his 70s who died at Concord Hospital and he tested positive on July 20th. There was a man who died in Royal Prince Alfred Hospital, and there was also the lady in her 80s who died at Liverpool Hospital, and the other gentleman in his 60s died at Westmead Hospital. So all were receiving, can I just say, excellent care, and that's another key message. One of the reasons why it's good for you to get tested is because once we have a diagnosis of COVID, we can also link you in and provide you with very much high quality care. But even with high quality care, COVID is a very serious disease, and that is why I'm pushing the vaccination message so strongly.
With the vaccines that were taken from the regions to inoculate the Year 12s, like from the Central Coast, how long is it going to take for those Pfizer doses that you just announced to reach those regions? And why wasn't the national stockpile of 50,000 Pfizer jabs used to inoculate Year 12s in the first place from southwest Sydney?
Firstly, those regional doses will be replaced in the week of 16th of August, and that's because the Prime Minister informed me personally last night that he was able to provide an extra 180,000 doses to New South Wales over the next 2 weeks. I'm very grateful for that because, as you know, a key priority of our government is to make sure that every student can sit the HSC. It's a legal requirement that there be a public examination process for every student to sit the HSC. We want to make sure, especially, that every child coming from those 8 local government areas has the opportunity to do their best, to be their best, not only to protect them against the virus and protect their family, but obviously also to go through the HSC process. And we know it's an incredibly stressful time for those children, for those students and their families, and that is why. And I think we've made very clear what our vaccine strategy has had to be adjusted given what we're facing here in New South Wales. I've been very vocal publicly about our need and want for more vaccines, and I think Dr Chant and I and the whole team New South Wales has been very vocal about the sense of urgency around vaccination for some months, even prior to this, because we can see what's happening around the world. We are looking at comparable jurisdictions who have higher rates of vaccination and higher case numbers than us, but yet they're keeping people out of hospital because of the vaccination rates. We know the vaccines stop the spread. They also protect life and keep people out of hospital, and that's why it is so critical. And every jurisdiction, every place around the world is finding Delta extremely challenging, and we can try and eliminate it, but we know that the vaccine is critical to stopping the spread, getting those case numbers down, and allowing us to consider options moving forward. And I can't stress that enough. And I can't stress enough why we're asking everybody to come forward and get vaccinated. And if anybody has any concerns about their health requirements, please go to your GP or contact your pharmacist. We're really beefing up the access points, whether it's through pharmacies. Obviously, GPs are really keen to do more, as well as all the pop-up clinics we've got in New South Wales, especially those in our regions, over 100 sites, and also, in particular, the additional sites, the mobile clinics, the outreach program we have in southwestern Sydney. Can I also make this important point? If people are keen to get back to work, get vaccinated. If you're keen to get back to work, get vaccinated. The New South Wales government is looking at incentives, and our incentives involve getting vaccinated. to be able to do those things that all of us want us to be able to do. So please come forward, get your vaccinations, make those bookings. I know that in the regions from today, people 18 and over will be able to book through the system to get AstraZeneca, and obviously that's already been the case in New South Wales. So we're trying to make the booking system easier and simpler. We're trying to make sure that people know where they can go to. But please know that vaccination is absolutely key to our way out of this. We will not get through this unless we see higher rates of vaccination. Firstly, to slow down the spread, reduce the case numbers, but also to keep people out of hospital, and also to allow us to get back to those things all of us are craving, whether it's seeing loved ones, that's at the top of my list, and whether it's also going to be able to get those essential services, which I know all of us are craving as well, outside our homes. I'm sorry?
The Teachers Federation has called for a delay in the return to Year 12 students on August 16th. They don't want that to happen under the current numbers of the state of emergency. What's your response to that? Will you do that?
My response is I just hope that all peak bodies appreciate that I don't think anybody in this state would disagree that a priority should be having Year 12 complete their HSC in a safe and as timely way as possible, and we're keen to make sure everybody sits their public exams that are required, keen to make sure there's little to no risk to students when they do that. And that's why we have to get especially those students in those 8 local government areas vaccinated. And of course, when you're not an adult, when you're under 18, Pfizer is the only option. And I don't think anybody would begrudge us for having a focus on getting kids back to school, starting with Year 12. I know everyone is under enormous stress and pressure, every single citizen, but we know those pressures are exacerbated when you're trying to homeschool and keep your own job, or run your own business, or get help and support. And so the stresses are there, and obviously getting kids back to school, especially Year 12, is a priority for us. And obviously that's the topic of conversations with our health experts in education in the coming days, and I hope to have more to say about that. But I don't think anybody would begrudge us for having the noble intention of getting Year 12 through this process with as little stress as possible, which is not really an appropriate turn of phrase for me to use, because I can't imagine what it would be like for those families, but I also can't imagine what it would be like homeschooling kids, trying to hold down a job or trying to put food on the table. These are challenging times, and I think our government needs to focus on the priorities and make sure we get our priorities right, so that that's where we can focus our energies. Alex?
Record cases, 5 deaths. You said yesterday we will turn the corner. How can we have any confidence that that is going to be the case when we see numbers like we have today?
Well, every day that goes by, our learnings increase. And that's why we're focusing on vaccinations in those 8 local government areas. And I've said from the beginning how critical it is to have those vaccinations. Whilst we have surveillance testing and extra testing coming out of those local government areas, we know that too many authorised workers, people that are putting food on our table or taking care of our aged care facilities, are not vaccinated. And that's a huge risk. So when you have people that have to be mobile, because otherwise, if we didn't let these workers work, we'd have no food supplies and no essential services. So the challenge is, if we get those people who are mobile vaccinated, that will help us deal with the case numbers. And can I say, whilst the case numbers aren't where I'd like them to be, they're certainly not where anyone wants them to be, we've done well holding the virus at bay to date compared to other places in the world. You look at anywhere else in the world and the case numbers would be through their thousands. So this is it. The vaccine, can I just finish, Alex, on this important point? Our ability to vaccinate those mobile people coming from those areas where the virus is circulating will help us bring those case numbers down. That is a fact. We know that even 1 dose of the vaccine reduces how contagious you are. It reduces your chance of passing it on to others. It reduces the chance of you having to be hospitalised. And our focus will be getting jabs into arms of those people, especially in those 8 local government areas that have to leave those areas for essential work. And again, our authorised list of workers is shorter than any other state has ever imposed. But the difference is the Delta strain. Is our restrictions are tighter in who's actually able to work. But the challenge is the Delta strain. That is the one different component. That the Delta strain is like nothing we've seen, and that's why the vaccine is our key tool. Fortunately, we do have that tool now available in Australia, but we are constrained with some types of supply, obviously, which we've been talking about. But getting jabs into arms will massively help us reduce those case numbers and massively improve our ability to have additional freedoms moving forward.
You said yesterday, Premier, it's on the same issue. We can follow it up on the same issue.
Person who went up to the Central Coast or the Hunt up to this party, were they travelling under an exemption? Were they legally allowed up there, or were they there because they had breached a stay-at-home order?
I'm sorry, I don't have details about that. Dr. Chant, do you? Yep.
Look, as I said at this point, the investigations are preliminary, and I don't think it serves us any purpose in speculating all aspects. But clearly we're talking about the fact that we want to know how transmission occurred, and we do believe that there is linkages back to Western Sydney. As I said, that's all I'm prepared to say on the matter, because our focus is working with individuals to track down the chains of transmission.
Are the full 40,000 doses being returned to the regions, not the
Yes.
20,000?
Yes.
And are 18-year-olds also being offered Pfizer in Greater Sydney if they're sitting their Year 12 exams?
So our focus for the Pfizer is that the Pfizer's has been provided through general practice, and general practice, the Commonwealth Government prescribes who is eligible for those vaccines under, and I'm not aware that that is an indication for it. There'll be many other people that are at risk that the Commonwealth would have been specifying for the GPs to be using the vaccines for.
18-year-olds that are getting vaccinated with 8 LGAs?
Oh, from the 8 LGAs?
Yes.
Yes.
Getting vaccinations for the HSC. Given as many as half of Year 12s are already 18, why were they not offered AstraZeneca like the rest of the population?
It's just easier because many of them won't be. Some of them will be as young as 16 and some of them will be as young as 18. So in order to get them effectively vaccinated, it is much easier to use one vaccine, so you haven't got the complexities in an operational sense, because we're also keen to put vaccines in arms as quickly as possible. And can I just say how overjoyed I am to hear that we are getting additional Pfizer vaccines. And it is important that we both have access to Pfizer and the AstraZeneca. We need as much vaccine as we can, and it is great to see that vaccine supply.
Are we at the point yet where we, as a population, now have to concede that these case numbers will keep increasing by 20, 30 a day until we reach those 50, 60% vaccination rates?
We are looking at everything we can optimise. We're working with a whole of government approach to support the affected areas. We are still got much more to do, and we are throwing out all stops in terms of stopping the spread. So whilst I know it is incredibly challenging to see the numbers at these levels, and also, can I just say, challenging for our health staff that still have to work every day and do the contact tracing, do all of the hard work. So yes, it isn't where I'd like it to be, but we are looking at every aspect of people's mobilities, movements, working with multicultural leaders. We are continuing to learn how the disease is spread and look at how possibly we can intervene in those transmission paths. And I think there's more we can do, but I think it's really important that everyone, as they move about, believes that they are at risk of acquiring COVID, because we do not want complacency in other parts of Sydney. As we've seen in the adjacent areas such as Strathfield and Burwood, we occasionally see cases and are seeing cases there. So it is important that no one is complacent, but again, we've got more work to do in those local communities to support them.
Say, just briefly.
Dr. Freetan's just said that there is more that can be done. At what point do you consider that, seeing, this is our worst case number days, we've had 5 deaths, at what point do you pull that trigger and do more?
Well, what we need to do more of is vaccinate people that are still mobile, especially in those communities where the virus is most prevalent.
But aside from vaccination...
But can I be very clear about this? Our best way through this at the current time is getting jabs in arms, as well as focusing on compliance. So no, this is a really important point to make. The evidence is there. The evidence is there to suggest that vaccination helps us deal with Delta, and we are looking at overseas jurisdictions of comparable size to New South Wales, and we know that high vaccination rates stop spread, but they keep people out of hospital. And as we've announced today, there is always opportunity for us to move in and out of restrictions as we need to if there's a particular flare-up, if there's particular issues. But please know, and I want to stress this point, that we have the harshest lockdown conditions that any state in Australia has seen. The difference is the Delta variant. And we've been able to knock every other part of COVID on its head in New South Wales for the last 18 months. We've been able to keep it out of our communities. We've been able to live relatively freely, albeit with restrictions. But what is different for this lockdown is the fact that this is the Delta variant. And yes, we can do more. We can make sure we're vaccinating those people who are still mobile and have to be. We can make sure we have very targeted approaches within those 8 local government areas. And of course, if at any stage the health advice asks us to consider other things, we will of course do that. But we also have to be real about what is causing the spread, where the virus is, because not only do we have to worry about people's physical health, but also their mental health and the way society continues to function. And that's why I'm pleased that we have the extra tool of the vaccine. And we've been very vocal about this for months. And Dr. Chant, myself and the whole team were overjoyed when we heard about those extra Pfizer doses, because it means we can replace those in the regions that we had to take, but it also means that we have opportunities to vaccinate younger, very mobile people who have to leave those 8 local government areas, because we know that's what's causing the spread. We know there are 2 factors, workplaces and households. And workplaces are because people with essential jobs, with critical jobs, are leaving those communities. And if they happen to get the virus from their workplace, they're then bringing it home to their households. And some households are between 10 and a dozen people. We're not talking 2 or 3 people. But if you're vaccinated, at least even with the 1 jab, you might pass it on to 2 or 3 in your household instead of all 10. And that is really important to note.
You're talking about the importance of getting that first dose, but people can't book an appointment for a first dose because they can't book the second appointment. So when they go onto the booking system, it says you can only book if there's availability for 2 appointments. And there isn't availability for 2 appointments, so therefore they can't book anything. So you've got people hearing your message every day saying, please get vaccinated, and they're trying, but they're unable to.
Yeah, look, we're improving any chinks there are in the booking system. We have to go through Health Direct, as you know, which is the federal health booking system, but we also are looking at ways in which we can improve our capacity to improve the bookings. I'm told that by today and tomorrow, people will see improvements in terms of booking, but please also make sure you're contacting your GP, especially in those 8 local government areas, contacting your GP, contacting your pharmacist. If there's a local pharmacist you trust, chances are they are providing the vaccine. And of course, a number of hubs. So looking forward to Monday to opening up Kudos Bank Arena in Homebush. Obviously, firstly, in that first week, in the week of 9th of August for HSC students, but after that for others. We've also had walk-in centres in Prairiewood and other places. So please know that if you live in those 8 local government areas, there's actually access points for walk-in clinics. You can actually walk in and get a jab without booking, and we're trying to make it as accessible as possible. So please know, don't give up. If you get frustrated the first time round, there are multiple ways in which you can access that. Community leaders also have good advice on how they can inform their community members if they're contacted. Leaders of religious organisations and places of worship also have that advice and information. And in fact, a lot of the centres we're providing vaccinations are actually on the suggestion of community leaders. We've specifically asked community leaders in various communities in those 8 local government areas, where are your people comfortable going? Where would people more likely feel they're in a safe and trusted environment? And we're also involving primary carers, GPs and others to be present during those times to provide that extra bit of confidence to make sure everybody feels safe and has the right options in making their decisions.
In those 8 LGAs, are you clarifying that the extra doses in those 8 LGAs will be open to younger people apart from just the HSC students?
Well, obviously, HSC students only have that one option, as Dr. Chan has explained, and both for age requirements but also for expediency and operation requirements, you need to give them all the same jab. It's very confusing otherwise and very difficult to keep track of. But in addition to that, obviously, the government will be taking the health advice. But clearly, as the health experts continually tell us, the biggest risk are those younger mobile people. So if you're someone who is caring and who's working in aged care and not vaccinated, that's a risk. Working, driving food around and nobody else can do your job, that's a risk. For people who are on that very short authorised list of workers still allowed to get out of those LGAs, they are posing, and I don't mean to single them out, but the reality is, if people are mobile and they're living in those communities where the virus is extremely prevalent, well, they are a risk to everybody, and that's why we will be focusing our efforts to reduce risk in those people that have to be mobile, because the science and the data is there. We've unfortunately been in this situation 6 weeks, so we have a greater understanding now of what we need to target. And if you look at what overseas jurisdictions have done, especially places and provinces in Canada which are comparable, they've had a very targeted vaccination program getting to those essential workers, and that's what we need to do in those 8 local government areas. And if our targeted program is clever and quick, we'll be able to see those case numbers go down. I'll go to you next.
Sorry, just in terms of incentives, especially in the 8 local government areas, are you looking at a no jab, no work policy?
Oh, look, we're definitely trying to consider options that are more positive, to say classes of employees can go back if they have had the vaccination. So we're considering those options. I don't want to rule anything in or out at this stage. And obviously our decisions will be based on health advice and what is critical. But we also appreciate basic things communities want to do all across New South Wales, all across Greater Sydney they currently can't do, to access some services or access getting back to work. And we do want to incentivise people for getting the jab in terms of occupations that might be able to go. So, potentially if someone that's providing a service is vaccinated and their client is vaccinated, will feel much more comfortable in relaxing that restriction on August 29. So I just want to say to people, if you're worried, talk to your GP, but otherwise please come forward and get vaccinated, because the government is looking at incentives to make sure people are able to return to a level of activity at some point in time in a safe way, and higher rates of vaccination give us those options. One thing is very clear, that until we get to at least 80% of our vaccination rates, we will have some level of restriction. It doesn't necessarily mean stay at home, but it does mean a level of restriction. And even at 80%, the Doherty report was very clear that social distancing, hand hygiene, mask wearing in certain circumstances will be a part of life for us until the strain of COVID goes, and we don't know when that will be. But it's important to note that we will be living with a level of restriction even when we get to 80%, but it will be so much more free than what we are now, including potentially international travel and all those other things. So we know we have to live with this strain, but we can live more freely once we hit particular milestones. And what the Doherty report did very well, I think, is put into context what 70% vaccination will look like, what 80% vaccination will look like. But that is still in the context of having a level of restriction. But I have to say, much, much freer than what we are now. And that's the basic message. We understand that if we hit particular milestones, our health experts will feel more comfortable in providing advice to us about certain things being able to resume in a particular way, and that is dependent on those high rates of vaccination. And I want to make that very clear. So it's not until we hit 70 or 80 that we can live life as freely as we would like with COVID, but even then, social distancing, QR codes, mask wearing in particular settings will be a part of life. But I don't think any of us will mind, because it will be much, much freer than what we have now. And that's why I'm really urging our citizens to come forward and get vaccinated. Please don't wait. Even a month during a lockdown is too long to wait, because we know from the health advice that it takes about 2 to 3 weeks for the first dose to have good impact. And so, the quicker our population gets at least the first dose, the quicker there will be that level of reduced transmissibility, reduced likelihood of being in hospital, and that all matters. And this is part of the weaponry we have in getting us out of this situation. But I think the way that we are going, everybody is craving extra bits of freedom, extra bits of things we can do. So my strong message is, ahead of having any concrete advice, because we're still some weeks away from the 28th of August, my message very strongly is get vaccinated, because that includes the options we have for how we live moving forward. Oh, sorry, I promised Liz, yeah.
It's week 7. When you announced the lockdown, you said no business would be left behind. Currently, people are struggling to get through on the phone to Service New South Wales. They go to the website, they don't know what they're applying for, the website is too difficult for them. We asked the Treasurer. The Treasurer says it's Minister Dominello. Minister Dominello says it's Minister Tudorhope. Minister Tudorhope says it's the federal government. Who in your government is responsible for making sure businesses don't go down the drain with the lockdown?
Can I stress this point? Firstly, that I did receive from preliminary advice yesterday to say our systems will be improving from tomorrow. So we just ask people to be patient in terms of the wait times. At the end of the day, I'm the Premier, so the buck stops with me. I have to make sure that we make the processes as efficient as possible, as streamlined as possible. The good news is that at least we know that the actual amounts we're offering are hitting the mark. The challenge for us is getting the money out the door to people who need them. So I apologise to anybody who's experienced unnecessary delay, because every day causes additional stress. But please know that our people are working night and day, and I understand in the last few days we've had an extra 400 staff come on board within Service New South Wales to provide those additional resources. We had employed an additional 1,000 during the pandemic, but we also need to make sure we cut out any red tape in terms of the form filling. In terms of normally you have some integrity measures in place to make sure people are being honest, but we'd rather forego that and make sure people are getting the money out the door. I probably shouldn't have said the last sentence, but you know what I mean. We're trying to reduce the red tape in order to provide access to the dollars as soon as possible. And I have been advised that things will improve from tomorrow, but please know that I'm watching that very closely, and all of us are accountable. But I also know that I'm the Premier, the buck stops with me, and it's my job to make sure things are as efficient as possible. Who hasn't asked a question?
You say it would have been confusing to have two types of vaccines for Year 12s. Isn't it more confusing to force 40,000 people across our state to have their bookings cancelled and rescheduled when you could have had a line for AstraZeneca and a line for Pfizer?
Oh, look, no, it doesn't work like that. When you're asking high schools to come forward, it's so much easier and efficient to vaccinate all high school students at the same time, at the same place during the course of 4 or 5 days. They're operational issues, and it means that we can get through around 20,000 students in a week. Now, that's a big, tall order, and we're hoping that many students come forward. So can I please urge parents and teachers and principals and members of the community to encourage all of the HSC students in those 8 local government areas to come forward for the vaccination, the Pfizer vaccination from the 9th of August. And please know that in a pandemic, no decision is easy, but I think everybody would appreciate that having Year 12s sit their exams across the state is an absolute necessity. And can I say to the children, to the students in those 8 local government areas, many of them are aspiring for a better life than the one they've experienced. Many of them are coming from backgrounds whose parents may have come from countries like my parents did, which have experienced tragedy. And the HSC, in doing well, is their opportunity for a great life. And I don't think anybody would begrudge us for regarding that as a priority, making sure they can safely sit their examinations. And some of them would be doing oral classes or music or all those subjects that require some type of face-to-face presence. I don't think anyone would begrudge us that. And I want to thank people in the regions who may have been inconvenienced just for a couple of weeks. But in the grander scheme of things, as I said, you have to make the best of what you have. And we have had limited supplies of the vaccines that we need. That is being addressed, and I'm grateful to that. I want to thank the Prime Minister for his personal intervention yesterday. I truly mean that, because he made commitments to me which I know will happen, and I'm deeply grateful for that. But whilst you're dealing in a pandemic, difficult choices need to be made every day, and I'm happy to take the criticism of those choices. But it's really balancing up what the priorities are, who we're supporting, and what the bigger picture is. And I think providing every child the opportunity to be their best across New South Wales, and many students in the regions in Year 12 are having that face-to-face. People in the Sydney area, Central Coast, Wollongong, Newcastle are not. And I just ask people just to be considerate, and I know it's hard, I would, absolutely. I don't regret that for a second. I know that's a hard thing to say, and I know people will probably be very upset with me that I've said that. But having Year 12 be able to complete their HSC is a priority for our government. And I don't think anybody across the state would genuinely begrudge that. I apologise if people feel inconvenienced, but it's only been for 2 weeks. And if we hadn't made that decision, the high school kids wouldn't have been able to get their vaccine from Monday. And that is the truth. I don't think Clinton's asked me a question
yet. I know it's not a priority for you at the moment, but are you going to, as the government, Mr Perrottet, have to look at things like a mini-budget later in the year? Because this is all hit a day after the budget.
Oh, look, we have the half-year review towards December, and I suspect Normally the half-year review happens in November anyway, and I think that will be timely. But please know that whilst we're always a government that focuses on jobs and the economy, when you're going through a major spike in cases and a pandemic as where we are, the first priority has to be health and safety. Unless you fix the health aspects, the economy will continue to suffer. And we know that the quicker we get on top of the cases, the quicker we get jabs in arms, the quicker we reduce the spread, then business will have greater certainty moving forward. And I think I've been very clear to say, coming in and out of lockdown is not a situation we want to be in. We want to make sure that we use this time in lockdown to get those vaccination rates up so that we maintain our ability to live life with certainty moving forward. And I appreciate it's a horrible time we're all going through, and I don't take that away. I mean, I miss my parents incredibly. I haven't seen them for 6 weeks, and I'm sure many others are in the same situation. But the reality is that unless you get on top of the health issues, unless you get on top of the health crisis that we have, the economy won't be looking too good. And I'm as keen as everybody to get businesses back up and running, people back to work. That's why, please, if you're a boss, if you're an employer, we've already had meetings with business leaders, both in those 8 local government areas and more broadly. Please put pressure on your staff to get vaccinated. We are doing that. We need you to help us. So we're really calling to business and industry, help us get your staff vaccinated, even if they're not allowed to work now, because chances are we'll be able to have them back sooner once they've had their vaccination, and that's a fact. Yeah. I'll go next. I'm sorry?
On what we were saying before about some businesses may be allowed to work if both of them are vaccinated, do you mean both doses, or would one be acceptable? And my other quick thing is some businesses say maybe you could use Dine and Discover as an incentive.
Oh, look, we're looking at Dine and Discover. I know a few businesses have approached us on that, and we've already got the teams working on that. In relation to 1 or 2 doses, that will depend on the health advice. If the public health team led by Dr. Chant says to us their preference is 2 doses, it will be 2 doses. But my message is, let's not waste time now. Don't wait, get vaccinated, because that increases our options moving forward. And it also helps us contain this outbreak. Please know the Delta, I know I keep saying this, but the truth is you can't compare it to previous outbreaks, you can't compare it to previous lockdowns, because it's a very, very different strain. And that's why it needs to be approached differently. And thank goodness we have access to some level of vaccine, because that is what is going to get out of this. I'll come back. That'll be the last question. Yep, sorry.
Premier, we're hearing that there are falls in the level of staffing at ICU in Westmead, that it's gone down to 2 to 1, 2 patients for 1 nurse in the ICU ward dealing with COVID. And I think you were asked about this.
Yeah, I'll ask Minister Hazard.
Hearing about it.
No, that's okay. I'll ask Minister Hazard to answer. Yeah, I'll ask Minister Hazard to answer that question. Then I'll take the last question from there. Yep.
And there's no doubt that the health system is under stress, because we have a massive battle, a war with the virus that to last night I think has taken 21 lives just in this current outbreak, and a quarter of those were literally in the last 24 hours. So yeah, the health team are under stress. Having said that, it's a very big system, and there are priority areas. ICUs, intensive care units, are priority areas. I was advised yesterday or the day before that Westmead was under pressure, but there are normally 36 beds in the intensive care unit there. The only reduction is to 32, which I thank the staff for all the work they're doing there, and they're still doing one-to-one nursing, as you'd expect, in an intensive care unit. So I'm not quite sure where you're getting your facts from, but that's the situation. Liz.
Just as a follow-up to that, has Wollongong Hospital been prepared to take excess ICU patients or overflow if things in Sydney get really bad?
Since the 25th of January last year, we've been talking about the fact that we have a massive health system here in New South Wales. It's a fantastic health system, but it's interconnected. And so at any stage there are patients who might be in one area who are looked after in another hospital for a variety of reasons. So none of that is unusual. And I'll just say this too, although it strikes me when I listen to some of the questions that are asked that there's a certain level of negativity, and I think Dr. Chan started off by asking all of the media to be with us on this journey. And I'd like to add to that. I want to thank broadly the media, because I think broadly the media have been very, very good. read the Sydney Morning Herald and the Daily Telegraph every morning, and occasionally the Australian. And I've got to say, I think the work that's going on through the print media is very, very good. I want to congratulate both papers on the work they've done. I particularly want to congratulate the Telegraph this morning. If anybody hasn't seen it, the Telegraph is extraordinary this morning with the number of people who are, in effect, getting on the journey with us. And it struck me as I looked at the paper this morning, I remember my grandparents talking about something called the Cooee March in 1915, between October and November, when 25 men marched from Gilgandra with one call to the community, and that was, come join us. Let me say right now is the time for all of you in the community, but also in the media, to come join us in this massive venture to try and get people vaccinated. I can't tell you how frustrated I am as Health Minister to hear otherwise intelligent people still saying, I'm not going to get vaccinated. Well, it's time to come join us. Stop being selfish. Stop putting health staff in the front line there to have to look after you when you get the virus. It is a dangerous virus. 5 people in the last 24 hours have lost their life. 70% of all the cases are now under the age of 40. For heaven's sake, get real, get with us, come join us, go and get vaccinated wherever you can get it. And there are numerous options now. There are options through GPs, there are options through pharmacists, there are options through the various state hubs, and of course the federal government has come on board offering in the next few weeks drive-ins. There is no excuse. There is no excuse to not go and get vaccinated.
Last question, sorry. Yeah.
Just on the issue of Queensland border, is there still a bubble there? Because people are saying they live just a few minutes on the New South Wales side of the border and they're having to isolate for 14 days or quarantine for 14 days if they cross into southeast Queensland to work?
Well, obviously, the Queensland situation is evolving as well. We just asked everybody to follow the health orders. Dr. Chan, if you have an update on the Queensland border. And that's the last question. Thanks, everybody.
So just to be clear, we're asking people to stay at home and also for their families to stay at home. So it isn't strict isolation. They are allowed to go out for the 4 reasons. But because they're potentially exposed as the unfolding outbreak occurs in Queensland, we just want to put those protections in for our northern communities. It's prudent, proportionate. They just have to not go to pubs, clubs. They can only leave home for the 4 essential reasons. So basically very much as if they are living in Greater Sydney. That's what freedoms they have.
One of their essential reasons is to work, and then they need to cross the border to work. Do they have to come back and spend 14 days at home?
It's not 14 days at home. They're subject to the stay at home. So if they go into work, they can come back, but them and the person plus their whole household are subject to stay at home. So what we're asking them to do is stay at home. So that means that person can go shopping for critical items, can go access healthcare, but they can't go to pubs, clubs, other venues. They can only leave for those 4 reasons.
Just up a check. I know it was the last one, but is this virus attacking the heart?
Thanks, everybody. We'll
We
be
seem
back
to
tomorrow.
attack the heart more than the lungs for the Delta strain.
Thank you.
That's what we've been told.
It can attack.
Can we just very briefly address that issue? I mean,
How about I give you some, through Connor, we'll give you some information on the complications and how it can occur, a myocarditis, which is the inflammation of the heart can occur.
Thank you.